Hello, my name is Dr. Dewan S. Raja. Today I will discuss multiple choice questions in Endocrinology 2. Let's start. Question number 1. A 27-year-old male presents with excessive thirst and frequent urination. He prefers cold water. His urine analysis revealed low specific gravity and decreased osmolality. Which of the following hormones released from the hypothalamus is most likely to be affected? Okay. Choices are growth hormone, thyroid stimulating hormone, anti-diuretic hormone, prolactin, oxytocin. So, which of the following hormones released from hypothalamus is most likely to be affected? What is that? That means this is the hormone that is decreased. So urine is not concentrated. It has decreased osmolality, low specific gravity. What is the hormone? That is formed in the hypothalamus from the supraoptic nucleus, and that is affected, that will be decreased. Answer should be the anti-diuretic hormone. C is the answer, anti-diuretic hormone. Question number 2. A 30-year-old man presents with fatigue, lethargy, constipation, dry and coarse skin, weight gain, and cold intolerance. His laboratory test revealed hyperlipidemia, anemia, and decreased free thyroxine. That is T4. Which of the following hormones released from the pituitary gland is most likely to be increased? Okay. A. Corticotropin releasing hormone, B. Thyroid stimulating hormone, C. Prolactin, D. Growth hormone, E. ACTH. So 31-year-old man. Okay. Features are fatigue, lethargy. They have somnolence, constipation, dry and coarse skin, weight gain, cold intolerance. So, which hormone released from the pituitary gland is most likely to be increased, not decreased, increased? What is that hormone? Corticotropin, thyroid stimulating hormone, prolactin, growth hormone, adrenocorticotropic hormone. Answer should be B, thyroid stimulating hormone. That is the thyroid stimulating hormone. Okay, let's go to the next question. A 25-year-old male complains of enlarged hands, feet, and prognathism. He has a recent history of increased head, glove, and shoe size. The laboratory workup revealed abnormally high serum IGF-1, that is insulin-like growth factor 1. Which hormone, when overproduced during adulthood, could be responsible for these symptoms? A. Prolactin, B. Thyroid stimulating hormone, C. Testosterone, D. Adrenocorticotropic hormone, E. Growth hormone. Okay, so 25-year-old, so bone already ossified, enlarged hand, particularly the soft tissue, feet, and prognathism. There will be change in the mandible and also in the forehead. Okay, recent history of increased head, gloves and shoe size. Laboratory work revealed high serum insulin-like growth factor 1, which hormone, when overproduced during adulthood, could be responsible for this symptom. Answer should be E, the growth hormone. So this is a typical picture of acromegaly. Okay, like this we have gone through that. Here this is a typical picture of hypothyroidism. Okay, now here this is a typical picture of diabetes insipidus. Okay, so the antidiuretic hormone is decreased, less produced from supraoptic nucleus. Okay, we got that. Now we'll go to the fourth question. Okay, so here a 22-year-old pregnant woman in labor, so she is most likely she is in late term of pregnancy. So she's in labor for 10 hours and her contraction means contraction of the uterus, are not strong enough. Which hormone produced in hypothalamus, stored in posterior pituitary and released during labor to enhance uterine contraction? Choices are oxytocin, B. prolactin, C. follicle stimulating hormone, D. thyroid stimulating hormone, E. vasopressin. So answer should be what? What hormone is produced in the hypothalamus? That is mostly in the paraventricular nucleus of the hypothalamus. It is stored in posterior pituitary, not produced there, released during labor to enhance uterine contraction. Answer should be A. oxytocin. Oxytocin is the answer. Okay, question number 5. A 38-year-old man is a patient, has difficulty regulating body weight, experiencing both excessive hunger and lack of satiety. Okay, dysfunction in which hypothalamic area is most likely responsible for control of satiety. So this person like to eat every time, anytime, and they are gaining body weight. Okay, so what are the functions of hypothalamus? Hypothalamus has many functions: endocrine function, temperature regulation function, the function like production of hormone, and also hypothalamus has also that also control diurnal rhythm, and also it is the small area of the brain, hypothalamus, that also is associated with the function of satiety. Okay, so what is that nucleus of hypothalamus that is responsible for control of satiety? That is the, what is that? Supraoptic nucleus, medial preoptic nucleus, suprachiasmatic nucleus, D. ventromedial nucleus, E. dorsomedial nucleus. Answer should be D. That is the ventromedial nucleus. Okay, so answer should be ventromedial nucleus. That is the site where there is satiety centered. So if that does not work, people will eat too much, will be obese. So our answer should be D, the ventromedial nucleus. Okay, so that